They cause a lot of symptoms. They cause women to have heavy menstrual periods and anemia, and they can grow quite large so that they press on a woman's bowel or bladder or give her complaints related to the size of the fibroid. The symptoms of fibroids are heavy menstrual bleeding is the most common one and often causing anemia, but then they can also make women look pregnant when they're not. They can make difficulty with bowel or bladder function, and sometimes they can interfere with getting pregnant or carrying a pregnancy safely to delivery. Sometimes fibroids are easily felt on a pelvic exam, but based on their size and their location, they can be quite hidden. So if you're having menstrual periods that are long or heavy, or having new changes in your bowel or your bladder, or difficulty getting pregnant, it's always a reasonable question to say, could this be uterine fibroids? We found out that women who undergo focused ultrasound surgery tend to do better with their recovery. They tend to take less pain medications during recovery, and they tend to return to work in their normal lives faster. They do have a longer treatment time. Most women have to be treated on 2 different days, but this was something that was hinted at in some prior studies, but we saw a definitive difference between the recovery in the 2 groups. Powerful ultrasound waves that go through a woman's abdominal wall and destroy the fibroid. The treatment itself is done in an MRI machine so that there's no incisions, there's no problem with blood loss, and the recovery is relatively quick. Uterine artery embolization controls the fibroids through their blood supply. That there's one tiny incision that is made so that a catheter can go to the uterus and use little pellets to block off the blood supply. It's very similar to what happens when people have a cardiac catheterization, but instead of using a balloon to open up a blood vessel, with uterine artery embolization, you use little pellets to block off the blood vessels.